Is plastic surgery safe for an overweight patient? So let's go by BMIs. As BMIs go up, the risks go up, specifically the risk for DVTs, the risk for wound complications. So the procedures can be done safely, but if you have a higher BMI, you have to go into the surgery understanding that you're going to be at higher risk for some of these complications. Is it safe to operate on adolescent patients? I think really the crux of the question is, would you operate and what are your criteria? So I'm very hesitant or cautious to operate on adolescent patients. I've only done it twice in 7 years, and both times I had psych evals, I had the parents on board, I met with the patient multiple times. So I think it's something you can offer the right person if they're emotionally and psychologically mature, stable, and if you really feel there's a great benefit to the procedure that can help them out. So yes, it can be done safely, but you have to be very careful to make sure that that person is emotionally ready for the procedure. Fat retention after surgery, I think the key word is unpredictable. Some people keep 50%, some patients keep 80%. The take home is, as long as you have proper nutrition, you're laying off your buttock for at least a week, you're doing hyperbarics, which I think helps a lot, then that's the best you can do to optimize. But even if you optimize, it's not going to guarantee you're going to keep 70-80%. Why would a doctor cancel your surgery at a pre-op? I think that's a very kind of broad question, but I'll give you reasons why I would cancel. If someone's smoking, I would cancel. If someone's pregnant, I would cancel. Also, I would cancel if I felt someone wasn't ready for surgery. Ultimately, we have our patient's best interest at heart, and if we're talking to someone and we feel like, hey, this person's not ready, we're not on the same page, maybe they don't quite understand the risk, or maybe their expectations are not something that I feel like I can deliver, then it's best to cancel. Why do we weigh more after lipo? Great question. It's from tumescent. So before we take out fat, we inject tumescent fluid. The tumescent has numbing medicine and epinephrine to prevent bleeding. So imagine I'm putting in 8 or 9 liters of tumescent fluid. That's almost 20 pounds of fluid. I'm removing some of it as well, but you hold on to some of the fluid, it gets absorbed, and after surgery, it's very common for your weight to be higher. I expect it to be higher for even about a month. Somewhere around 3 months, it'll normalize. If I have a fever after surgery, do I have to be worried or concerned? If you have a fever, the first thing you have to do is call your surgeon. So I'll talk in general what fevers are most likely from. The first 24 to 48 hours is very common to have what's called atelectasis, which means the lungs collapse. And that creates inflammation. Inflammation leads to fever. Having a fever doesn't mean an infection, it just means inflammation. Other common causes could be an infection. You usually don't see that until about 5 to 7 days. So it could be multiple things. Definitely call your surgeon. How much weight will I lose from lipo? I don't think anyone can really give you an exact number, especially if you're doing a fat transfer, right? So think about it. If you're taking out 5 liters of fat, but then you're putting 3 liters back in, the net difference is very small. So I don't promise weight loss. I don't promise a number. It can vary between 2 pounds, 5 pounds, it could be none. Remember too, some of it depends on your eating habits too. Mommy makeover recovery. I think recovery questions can be a little misleading because everyone recovers differently, so we can't promise an exact recovery process. Average patient, 2 to 3 weeks off of work, 3 months they're totally healed. I've had some patients with 360 VBL, tummy tuck breast lift who don't take any pain meds and they're bounced back at a week or 2 weeks. That's not common, but some do it. I've had other patients just get a BBL, for example, and they're out for 3-4 weeks. So it varies. I gave you the range, but everyone's different. What does a day after surgery for you as a patient look like? For most patients should be ambulatory, moving around. They're taking their medicine around the clock. They're sitting up in a chair. They're doing all their normal activities like feeding, brushing their teeth, going to the bathroom on their own. They're going to be sore. They're going to be slightly in some discomfort. All surgeries have common risk: bleeding, infection, trauma to tissue. Depending on the surgery, different surgeries have specific risks. For example, tummy tucks can also have problems with the wound, problems healing. This could be something such as wound separation. It could be necrosis. Necrosis could be a small amount. It could be a larger amount. It could be partial thickness. It could be full thickness. BBLs, for example, one of the risks with them is fat necrosis, where the fat dies. That can look like an infection. I would say those are the most common. Can you do things before surgery to help you heal? I think the number one thing is going to be hyperbarics pre and post-op. I think that also just being a normal BMI, having good nutrition, taking antioxidants all help a little bit. But ultimately, how you heal is how you heal. And besides hyperbarics, I don't think there's anything out there that's really going to be super high yield for healing, assuming, of course, the patient is well nourished, hasn't had any medical problems, good nutrition. How much fat can you safely remove from liposuction? There's no exact number. I'm actually in the process of publishing my data, 500 patients, all high volume, where I took over 5 liters up to 14 liters. It's a complex question, but the easiest answer is that there's no exact number that's considered safe. More than 5 liters can be taken, but you have to be experienced, you have to know what you're doing, it has to be done in a certain way, it has to be controlled, and you need appropriate post-operative monitoring as well. Why do you use drains in plastic surgery? There's 2 different reasons. 1, to keep an incision open to allow fluid to come out. That's why we use them in lipo. 2, we use them anytime we lift up skin and elevate a flap. That could be done in a facelift, a breast lift, a tummy tuck. When you elevate skin, you create that space, which means open space, and that space does accumulate with fluid. And what the drain does is help remove that fluid and blood until the space can stick down and close off. When can I travel after plastic surgery? Usually, if it's a local trip, I do 7 to 10 days. If it's gonna be more across country, I would say 2 weeks. What can you not do after a BBL? You cannot drive. You should not sit directly on your butt. You should not go to work. You should not avoid taking your antibiotics. You should not come to your follow-ups. Okay. What should you do after your BBL? You should walk around, be ambulatory, have good pain control, take your antibiotics, and please come back to see your doctor. We miss you if you don't come see us. You have to tell your plastic surgeon before surgery. Number 1, please tell us if you're smoking, even a little bit, the vape, the Juul, I don't know what it is. There's all this stuff out there. Please tell us if you're smoking anything. It could affect healing, it can affect the anesthesia. 2, oral contraceptives, birth control. A lot of patients forget to tell us this. It's a big deal for blood clots. 3, I think if you're under emotional distress, you shouldn't have surgery. So if you're coming in for a consultation, you want to come in and do a surgery, and you're not in a good headspace, talk to us. We're people too, we understand. You may not be, even though you could be physically ready, you may not be emotionally or psychologically ready for a surgery. I think that's a big deal and something that's very commonly overlooked. Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.